It is 3 a.m. A physician sits in a dark radiology room. They must review hundreds of high-stakes scans before their shift ends. The mental load on these operators is immense. Hospital boards deploy AI for autonomous diagnostics. The exhausted night shift operator treats that same software as a tool to finally rest their eyes. We are deploying high-accuracy diagnostic models. These models actively mask a severe drop in human vigilance. A precise diagnostic algorithm holds zero structural value if its deployment puts the human operator to sleep. The 2026 International AI Safety Report serves as the definitive global audit of these clinical failures. The data confirms a hard physical reality. Sustained exposure to AI-assisted diagnosis measurably restricts operator autonomy. This chart illustrates the exact quantitative baseline. After 3 months of software support, clinicians experienced a 6% drop in their ability to detect tumors without AI assistance. This decline represents a structural erosion of baseline medical capability. The machine gets sharper, the human degrades. Integrating accurate AI without engineered safeguards replaces human skill. This exposure creates systemic risk for the patient. Consider the physical reality of the frontline operator. A radiologist reviews hundreds of complex scans per shift in total darkness. The human brain is an energy conservation engine. It naturally delegates demanding tasks to an external system. We call this cognitive offloading. This offloading occurs the exact moment the software draws a bright yellow bounding box around a suspected anomaly. The operator's attention immediately snaps to the yellow box. They abandon the perimeter of the image entirely. This specific UI design forces a behavioral shift. The doctor stops operating as a diagnostician. They start operating as a box checker. Operators over-rely on automated outputs. They begin to discount their own baseline training. Physical exhaustion and high throughput demands actively accelerate this bias in clinical environments. We can track the operator's eye movements to see the physical evidence. The heat map stops sweeping the monitor. It concentrates exclusively inside the yellow AI bounding box. The human eye now entirely ignores the dark corners of the scan. This creates a compounding danger when the software encounters an out-of-distribution failure. AI models degrade when analyzing unfamiliar lighting or unusual biological contexts. Automation bias strips the hospital of its human safety net. The entire clinical system becomes dependent on the machine's blind spots. High-level IT dashboards ignore the physical reality of the reading room. Hospital executives currently optimize for two parameters. They measure model accuracy and processing speed. They miss the critical metric. IT architects fail to track operator attentional decay over time. Prioritizing speed over cognitive engagement generates a structural failure. It quietly drains capital through misdiagnosis liability and redundant scan reviews. We must apply the principles of restorative engineering. Technology must actively maintain and demand human capability. Software architects must impose severe boundary conditions, building engineered friction into the UI. In the delayed overlay test, the system withholds the AI bounding box for 3 seconds. The operator must physically click to register their preliminary judgment before the AI reveals its findings. Inserting this micro-delay forces the human eye to perform the initial sweep. This physical friction actively blocks cognitive offloading. These random cognitive engagement checks restore the operator's professional vigilance. Hospital IT architects and chief medical officers must mandate this deployment protocol immediately. Operators must audit their clinical deployment logs. They need to measure the human interaction latency prior to AI overlay activation. The execution metric is clear. Operators must maintain a 90% physical click engagement rate within the initial diagnostic window. Enterprise AI succeeds when the machine's precision actively demands the human's full attention.